Hi, everybody. My name is Mandy Torres, and this is my presentation on using technology for patient education with the mobile health technology. First, I'd like to just start off by defining what mHealth or mobile health is. Mobile health encompasses the use of mobile devices like smartphones, tablets, and wearable sensors, and to promote health and manage disease. Um, the benefit is that it improves healthcare access, affordability, and patient engagement. Also, empowers the patients to just manage their health. It enhances communication among providers and patients and promotes disease management. Um, One of the major questions here is how is this technology useful in a primary care setting? Like for family nurse practitioners, is what we're studying to do. Specifically telemedication. This helps facilitate virtual consultations with the healthcare providers, doctors, nurses, therapists. It can also be used as a self management tool, right? Provides patients with apps and devices for tracking symptoms and managing chronic diseases, which is kind of what we're talking about here. Health record access, just allowing patients to be able to get on some sort of platform and view their medical records on their mobile devices, which is huge nowadays because, I mean, how many people really have a laptop or a desktop computer? It's mostly mobile. And also, it's useful in the setting because it just enhances communication between the healthcare provider, the patients, families, also just leads to like better coordinated care and improved patient outcomes, being able to connect with the patient's therapist or another specialist that they're working with. This mobile technology allows that to be enhanced. So here's our patient profile. The patient's name is MJ. She's a 58-year-old female. She has congestive heart failure, diagnosed at age 54. So we're about 4 years with this disease. She has hypertension, coronary artery disease, type 2 diabetes, and also a sensory processing disorder. Her health literacy is that she understands basically a fundamental understanding of health information and believes that she can utilize at home monitoring tools and electronic health records. She also does report a desire to help reduce the signs and symptoms of the congestive heart failure and thinks that she can help along those lines. She reports that her learning strengths are she has great problem solving skills. She does have some slight visual impairments that can make it difficult to receive and process information, but not too bad, she reports. So, three mobile technologies that can be helpful in supporting her management of congestive heart failure is self monitoring and tracking. So, she can use and patients can use apps and wearable devices like smartwatches to track vital signs, blood pressure, heart rate, oxygen saturation, symptoms, and physical activity. Number two is medical adherence. These apps can send reminders to take your medication at the right time, the right dose, and just can improve adherence. And then number three is education and support. These mobile health apps can provide patients with educational materials about congestive heart failure, including information on diet, exercise, medication, and symptom management. Now, this slide is specific to technology that would be for MJ. She can use what's called the HF Helper. It's this app powered by the American Heart Association. It just provides a health journey with daily tasks, educational resources, and check-in questions to track mood, energy, and symptoms. How this is beneficial to her, because it can help her with taking her medication trackings, logging her symptoms, educational resources such as diet and exercise. Another good fit for MJ would be an Apple Watch. It enables continuous monitoring of her heart rate and provides notifications for irregular rhythms, and some even offer the ECG capabilities. Again, this is just beneficial to her because it can help set a baseline and it can also notify her of some changes in her heart rhythm and things like that. And some studies have shown that these devices can identify any irritation or progression of congestive heart failure. And there's like, if you Google it, there's tons of stories about how these Apple Watches have helped diagnose heart problems and things like that. And then another specific technology for MJ would be um, blood pressure monitoring. And that's because it can be captured continuously with a wearable device. And it just leads to better blood pressure management, early identification of that deterioration, and fewer hospitalizations. And also, these sort of things, research tend to show just empower patients to be more active in their care, which would be beneficial for MJ, especially because she reported to want to be more active in it. I just kind of threw this in here because of what I said before. Um, there's a lot of information out there, but I found this one really interesting because it just shows that like they can predict future heart problems. And there's, here's the population, here's the study, and basically it's saying that um, if you had some irregulars on your smartwatch, you had or an extra beat, you had faced a double risk of developing heart failure or condition known as AFib within the next 10 I'm sorry, within the next decade. So I thought that was kind of interesting just to show in there that these are really very helpful tools. Apple Watch, why is the right choice for MJ? Again, it monitors response to treatment and activity monitors such as research tools, and you can use its quantitative measure to track responses and real life symptoms. Also help improve blood pressure control. The use of these devices for anti-hypertensive or heart failure medications also allows for anhydronic hypertension and support adherence to therapy. She does have a history of high blood pressure, so it does make her a good candidate for this device. And also, smartwatches incorporate like gamified elements, badges, achievements, and challenges to like work out and do the right exercise and do those things. So it just kind of helps motivate people. And again, she says that she actually likes playing games, so this might be a good reward app system to help boost her mood. This is I really like this picture a lot. It's connecting the clinic to the patient via remote monitoring, right? Because that's kind of what we're talking about here. Really the bigger picture. I really like this one because it just highlights the importance of technology and how it can help MJ. Something like the wearable devices, the implantable HD monitors, those things. This picture does a great way of showing how all of that benefits and enhances care for the patient. How you can do remote monitoring during stable, early relook, history, and early relook, and referred for full services. And then all this information can just be like very easily sent over to the clinician. And then from there, they can collide with other providers and social workers and things like that to figure out the best plan for the patient. And this is all simply just by wearing a device that tells you, my heart's beating a little bit faster or things like that. And this is just like the highlight of how important this really is and how it's revolutionized um, remote patient monitoring. So I just really like that picture. I really enjoyed it. And this is, just talking about how to apply the technology, right? Because she may not be familiar with a smartwatch or how to use a home at home blood pressure monitor. So, how to apply this would be to give her education because that's so huge, like we talked about before. So, it's really crucial for successful remote patient monitoring. So, we can do some things like educational videos, user manuals, and follow up consultations, right? We need to know if what we're teaching her is if she's understanding it, is she applying the information correctly, did we start a new medication, that sort of thing, based on what we taught her with this educational piece. And then here's our 3-month follow-up. She visited the clinic after using this Apple smartwatch for about 12 weeks to track her heart rate at home. The home blood She also reports that the home blood pressure monitoring is progressing well. She reports feeling more empowered and control of her health, and the smartwatch has inspired her to get her steps in and giving her better, and has been giving her better understanding of that sensation of skipping a beat. She's monitored instances when her heart rate's elevated to provide reports, and and these reports are going to be able to use to reevaluate medications and figure out if the treatment plan is working. And then here's my reference page. I apologize. It's not fully formatted correctly because of the app, but that's all I got for you. So thanks for watching, guys.